Dear citizens, this is an update on our response to the COVID-19 virus. I hope all of you celebrated a very nice Easter weekend during this last weekend. And for all our Jewish friends, that you continue to celebrate your Passover feast. Let me start by giving you the latest numbers on our testing. The total number tested was 1,455. 150 of those were public testing, and 1,305 were private testing. Out of all those numbers, 198 tested positive, 1,190 tested negative. We still have 75 that are pending. 32 are in the hospital. 6 of those 32 require ICU care. We've had, unfortunately, 1 death. The good news is 30 have been released. Also that I think is good news is that of all the counties in the state of Texas, and I think 176 counties in the state of Texas have experienced some positive findings of the virus. Out of all the counties that are at least 300,000 or more in people, Hidalgo County is the #1 in having the least amount of positive tests for every 100,000 people. So that's pretty good. That is good news. If you're wondering about our hospital preparedness, we have 357 beds available, 107 ICU beds. We have 163 ER beds. We have 210 in ventilators. We have 21 emergency room negative pressure rooms and 52 negative pressure rooms throughout the hospitals. Most, if not all, hospitals have made arrangements for overflows site facilities in the event that this really escalates to a point that these numbers are not sufficient. So it would require a very significant spike in order for the hospitals not to be able to support us. What have we learned so far during this past 23 days that we had our first positive test? We know that the number of people testing positive is still growing. We know that the people that are requiring hospitalization is growing. We know that the number of people requiring ICU rooms is growing. We know that there is no clear cure for this disease, nor is there any treatment for this disease. There is evidence to support that physical distancing ourselves from one another and covering our mouth and nose help to prevent the spreading of this disease. The medical communities now are trying to investigate and search in ways of how to mass test for an IgG antibody to help fight this disease. What are some of the unknowns? You know, recently, many of our residents traveled north, going somewhere north of the county, and many traveled south, going to Mexico to see parents, to see family and friends. Also, we have a lot of oil field workers that have been working somewhere in the oil fields that have been laid off and furloughed because of the decline in the oil prices. They're all coming back. We don't know what this is going to mean to us. So this next 7 to 9 days is going to be very important. It's going to tell us more or less where we are with this infection rate. You know, some citizens are criticizing the veracity of modeling and information that's been given out in the early days of this disease. Unfortunately, many of the early models were simply what-if models that were based on hypothetical projections. It really wasn't based on any strong data points that were attributable to actual experience. These were just what-if models. What if this happens? Well, now We do have data points because we do have experience here in the United States. And there are several models that were being developed. Some of the models that were being developed were using data points from international numbers, what they experienced somewhere else. And of course, we have a lot of experience now with New York and California. So now we have data points coming from those things. So the healthcare industry, especially all of our hospitals down here in the Rio Grande Valley, have taken advantage of that methodology for modeling and have come up with some estimates of when they think we're going to peak, or peak period is going to be. We believe that based on that data, that the peak period may come as early as late April, which is just around the corner, or it may take as long as the third week of May. We don't know. And we don't know, as I said, what's going to happen with all these travelers are coming back to see us. But you know what? We continue to have our fingers crossed. So what are we expecting? Well, unfortunately, we're expecting for testing positive to continue to increase. And we expect for more deaths, unfortunately. That's why this is not the time to relax our community controls. We must continue to take action to slow or stop this virus. I received comments or questions about our public schools, and I want you to know that the Texas Educational Agency is in charge of making those decisions. So we're going to be meeting with our area superintendents to talk about how we can partner together and make sure that our children are well taken care of. I also have received information or questions regarding, well, what's going to happen to the children and the elderly that require food service. Well, we're working very closely with people like the food bank, the schools themselves, and the CSA here in our county to make sure that the food supply continues for those in most need. There was a question why did I ask for the National Guard to come to Hidalgo County? Well, I asked the National Guard not to bring their guns or cannons, but to bring their bodies to possibly help us in the distribution of the food supply. We want to make sure that we have an organized group of people to help us do that. Sometimes it's very difficult to do that simply with volunteers. So if you hear that I called the National Guard, the answer is I've asked for their support in the distribution of food supplies. You know, we know that these community controls and this virus has really taken a burden, a financial burden of many, many people. So we need to put a lot of effort to bring back our economy as fast as we can. So I have named a task force of leaders here in our business leaders here in our community to help us come up with a plan to bring back as many of our businesses as early as possible and for us to bring our economy back. So we're working on this. I also want to make sure that, you know, I allow you to have as much physical activity as possible. Staying at home and not being able to go is really very challenging for a lot of people. So we're looking at our order to make sure that we can give you all of the freedoms that we can for physical activity. I'm very proud of our government. You know, there's at least 15 federal agents that are working on behalf of the American people in response to this outbreak. I'm very proud of our congressional delegation who is working for us, and also our Rio Grande Valley delegation that have done just really good for us to make sure that we get our share of things. I'm going to ask my public information officer to give you more details about all of the different programs that are available so everyone in Hidalgo County can take advantage of it. Lastly, you know, we're waiting for President Trump and Governor Abbott to give us more direction as to what they think we're going to do. Unfortunately, these are difficult times, but I want everybody to know that Hidalgo County is doing the very best that we can to keep you safe, provide you the necessary services that you need. And we're going to be giving you an update every time we think there is a significant reason to do that. And just bear with us. The next 10 days are going to be very telling as to what we think more likely than not is going to happen. So with that, I thank you. I thank you for your support. I thank you for your prayers, and I wish you many blessings.